What is fetal demise and how does it impact expecting parents? Fetal demise, also known as stillbirth, is a term that refers to the unfortunate loss of a developing fetus in the womb after 20 weeks of gestation. It's a devastating experience that affects expecting parents deeply. One of the first signs of fetal demise is a noticeable decrease or complete absence of fetal movements that the mother had previously felt. This lack of activity might be subtle at first, but it's often the initial red flag that something might not be right. Another sign can be discovered during routine prenatal checkups. This is when the healthcare provider, despite their best efforts, can't detect the baby's heartbeat. This absence of a heartbeat is often a clear indication of fetal demise. The lack of expected growth or development of the fetus can also be a sign. During routine measurements or ultrasounds, if the fetus isn't growing as it should be, it could suggest a problem. Now, it's important to remember that these signs are often subtle and can easily be overlooked. The sudden realization of fetal demise can be a shock, and the emotional impact is immense. It's an incredibly difficult reality to accept, and many parents might initially struggle to come to terms with the situation. There's often a sense of denial, a hope for a mistake or a miracle, but the shock eventually gives way to profound grief. This grief can be overwhelming, manifesting in feelings of sadness, anger, guilt, and despair. This grief is similar to the mourning process after any loss, and it's a natural part of coming to terms with such a significant event. The signs of fetal demise are often subtle and can be easily overlooked, but they are crucial in helping to identify a potential problem. The discovery of a fetal demise is a devastating blow to expecting parents. It's a shocking revelation, a sudden and painful interruption of dreams and plans. The emotional impact is immediate, and often it's an overwhelming wave of disbelief, sorrow, and confusion. At first, there might be a sense of denial, a hope that there's been a mistake. Parents may find themselves questioning the diagnosis, praying for a miracle, or hoping for a misinterpretation of the ultrasound or the medical tests. Denial in this stage serves as a defense mechanism, a temporary buffer against the harsh reality. But as the reality settles in, the initial denial gives way to an overwhelming grief. The loss of a child, even one yet to be born, is a deep, personal sorrow. It's a grief that's often misunderstood or minimized by society, but it's real and it's profound. Parents may experience a range of emotions: sadness, anger, guilt, despair. Each parent's journey through grief is unique, and there's no right or wrong way to feel or grieve. The shock of a fetal demise isn't just about the loss of a child. It's about the loss of a future, the shattering of dreams and expectations. It's about an empty crib, unused baby clothes, and unfulfilled plans. It's about the painful contrast between what should have been and what is. Dealing with the shock and grief of a fetal demise is a process. It requires time, patience, and support. It's about learning to navigate through the waves of grief, allowing oneself to feel the pain, and gradually finding ways to cope and heal. The shock and grief following a fetal demise are profound and life-altering. But remember, you're not alone. Seek support, talk about your feelings, honor your baby's memory, and most importantly, give yourself permission to grieve, to heal, and to find your own path through this journey. After the confirmation of a fetal demise, the birth process follows. This is a challenging stage, but it's important to remember that you're not alone. Medical professionals are there to offer support and guidance. Firstly, there's the medical evaluation. Doctors will discuss the next steps, which may include inducing labor or performing a cesarean section. The aim is to keep the mother's health as the top priority, while also considering her emotional well-being. Next comes labor and delivery. This process is akin to a live birth, with the mother experiencing contractions and eventually delivering the baby. It's an emotionally taxing experience, as the joy typically associated with childbirth is overshadowed by profound sadness. Yet it marks a crucial part of the journey, allowing parents to begin the process of saying goodbye. After the delivery, parents often choose to see and hold their baby. This is a deeply personal decision. For some, it provides a chance to connect with their child, to memorize their features, and to say a heartfelt goodbye. It's a moment of intense emotion, of love and loss intertwined. Throughout this process, hospital staff, including bereavement counselors, are a vital source of support. They can offer comfort, provide information, and guide parents through the difficult decisions that arise. Their expertise and empathy can be a beacon of light during a time of darkness. The birth process, though painful, is a necessary step in the journey towards healing. It's a time of closure, of saying goodbye, and of beginning to navigate the complex emotions that follow a stillbirth. It's a process that's undertaken with heavy hearts, but also with the knowledge that this heartache is a testament to the love that was, and always will be, there for the child who was so dearly anticipated. The aftermath of a fetal demise is a complex and challenging journey. It's a path paved with profound grief, mourning, and countless questions about what the future may hold. The loss of a child in the womb leaves a void that cannot be filled, and a wound that heals slowly, if at all. Grieving is a deeply personal and unique experience. For some, it may feel like a heavy fog that settles in the heart, making the world seem dull and distant. For others, it might be a tidal wave that crashes down without warning, leaving them gasping for breath. The pain can be overwhelming, and the emotions can be chaotic. Sadness, anger, guilt, despair, they all have their place in the grieving process. In the aftermath of such a loss, it's essential to remember that you are not alone. Bereavement counseling, support groups, and therapy can play a vital role in navigating this new landscape of grief. They provide a safe space to express feelings, share experiences, and learn coping strategies. It's okay to reach out, to lean on others, to ask for help. It's okay to grieve in your own way, at your own pace. Memorial services or ceremonies can also be a part of the healing process. They serve as a tangible way to honor and remember the baby. They can be as unique as the child they commemorate. A quiet moment of reflection, a gathering of loved ones, a release of balloons into the sky. These rituals can provide closure and a way to channel grief into an act of love and remembrance. Looking towards the future, the thought of another pregnancy can be daunting. The joy and anticipation are often tinged with fear and anxiety. It's normal to have concerns, to wonder about the chances of experiencing another loss. Seeking medical advice and counseling can help address these fears and provide guidance for future pregnancies. It's okay to take your time, to wait until you feel ready to take that step again. The aftermath of a fetal demise is not a journey that anyone should walk alone. Support and understanding are vital in helping parents navigate this difficult path. Remember, it's okay to grieve. It's okay to ask for help. It's okay to take your time. You don't have to have all the answers. You don't have to be strong all the time. In the midst of this sorrow, remember to cherish the memory of your child. They may not be in your arms, but they will always be in your heart. While the pain may never fully disappear, it will change and evolve over time, becoming a part of you. It's a testament to the love you carry for your child, a love that endures beyond loss, beyond grief, beyond time itself. The aftermath of a fetal demise is not a journey that anyone should walk alone. Support and understanding are vital in helping parents navigate this difficult path. Fetal demise is a profound and painful event that leaves lasting emotional scars. It's a journey that begins with signs such as a decrease in fetal movement, lack of a heartbeat, or no fetal growth. The shock of this loss can be overwhelming, leading to a wave of emotions from denial to deep-seated grief. The birth process, whether induced labor or a cesarean section, is a difficult ordeal. Many parents choose to see, hold, and spend time with their stillborn baby, a heartbreaking yet significant step in the grieving process. The aftermath is a time of intense mourning, often accompanied by counseling and support from professionals. Memorial services may be held, and concerns about future pregnancies are common. While the pain of fetal demise is immeasurable, it's important to remember that you are not alone and that help is available. It's a journey of healing, of cherishing memories, and of finding hope amidst the sorrow.